Hi everyone, I'm Dr. Durgaprasad Reddy, Head and Professor, Vydehi Institute of Cardiac Sciences, Vydehi Hospital, Whitefield, Bangalore. When someone has been told he's having a healthy heart, that means he doesn't have any coronary artery disease, a rheumatic heart disease, or a congenital heart disease. That means the person is free of all the diseases. Whereas the congenital heart disease is right from birth, coronary and rheumatic is acquired. So, how to prevent this? How to make ourselves healthy? There's a lot of things. Suppose let's talk about congenital heart disease. There's a lot of things like pregnant women should not take alcohol. Once she starts taking alcohol, what we get is a fetal alcohol syndrome. That means you get a congenital heart disease like ASDS, VSDS, and Tetralogy of Fallot. And other thing is consanguinous marriage. First degree of consanguinous can produce a lot of congenital heart diseases, and maternal rubella. Then patients having steroids, diabetic, mother having a congenital heart disease can get 15% get transmitted to children. So this is how you prevent a congenital heart disease. And early echo, fetal ultrasound at the 5th month is very important to prevent this. If there is any complex and the child is not going to survive anything, we can plan the pregnancies in much earlier stage. And when you talk about rheumatic heart disease, is an infection of the valve. So whoever has got a sore throat in younger age, which is severe, try to consult a doctor, take appropriate antibiotics so that it doesn't go and affect the heart. And of course, coronary artery disease is very, very prevalent in our country, especially because of our lifestyle modification. So, what is coronary artery disease? Is the block in the coronary artery which supplies the heart. Suppose there is a block in the coronary artery, you will experience a heart attack. How do you prevent that? There's a lot of things, like everything has to be in moderate. You can't do anything excess. Like you can't do excess exercise also, which is bad because you sustain the heart rate for a very long time. So moderate exercise, walking is the best exercise for the heart, the cardiovascular exercise. And you have to have a balanced diet. Don't eat anything excess, eat in moderate amounts. Eat everything, but eat everything nice balanced diet. In practicality, to say, try to avoid tasty food which is very rich in fat. And secondary thing is you can't smoke. Smoking is worst for coronary artery disease. What happens in smoking is it will clog the arteries, and it will just block the arteries and produces heart attacks. What happens when you smoke? And 3 cigarettes is enough, to kill you. So I always suggest, don't smoke. Nicotine stays for 8 hours. So always avoid smoking. And even alcohol, a lot of people say, little bit of alcohol is good for heart. It's not true, because the moment you start taking alcohol, the coronary artery becomes dilated. So the supply to the muscles takes very long time. So always avoid alcohol so that you can prevent coronary artery diseases.